April is National Minority Health Month. The health observance highlights the importance of improving the health of minorities. Diabetes impacts our country's Hispanic, Black, American Indian, and Alaskan Native communities disproportionately. Adults from these racial and ethnic communities are more likely to be diagnosed with diabetes than other groups. So joining us to explore the topic is Dr. David Pearce, Chief Medical Officer for the City of Houston. Thanks so much for coming on to talk with us this morning. First, I'm asking, thanks, what is diabetes? Because we know there are different types, but when we're talking about this one that disproportionately affects these minority groups, which type are we talking about?
Yeah, it's a good question. There's two types of diabetes. There's type 1 and type 2. And type 1 is where your pancreas either doesn't produce any insulin or it produces too little. This is for folks who are, taking insulin. They're getting either by an injection or a pump, and this is something that you're born with generally. So it's diagnosed sometimes, at birth or in the first few years of life, but pretty much always before the age of 20. It's different from type 2 diabetes, which comes on later in life and is diagnosed generally in people over the age of 30. And this is where your body's producing insulin, sometimes the normal amount, sometimes even more than normal, but your body doesn't react to it. It's become sort of numb to the insulin. And so that's a completely different sort of problem.
Got it. So how pervasive is diabetes in Houston and among minority populations? Can you talk about that?
Well, it is certainly not uncommon. Across all Houstonians, we see about 12% of adult Houstonians have got some form of diabetes, either type 1 or type 2. But when we look at our predominantly black neighborhoods, such as Clinton Park or Settegast Sunnyside, it's almost double that. It's in the low 20%. So that's a really significant amount. And similarly, in our predominantly Hispanic neighborhoods, Magnolia Park, for example, is 18%. Denver Harbor is just a hair below that. And so we are seeing significant differences in our minority neighborhoods.
And do you think there are a lot of people living with it that have not been diagnosed, or is that just something that, you would get severely ill, you'd know soon if you had it?
Yeah, well, a good question. So eventually you're going to know, because it will make you really sick at some point. There are people that, early on in the diabetes, when they have it, it's just coming. This is particularly for the type 2 diabetics who develop it as we get older. They can have problems. You're going to notice that you're going to be fatigued. You're just not going to feel good. It's because you're not using the sugar in your body the way you should. You may notice that you're going to be urinating a lot more than usual. You're going to be more thirsty than usual, sort of subtle things, but you're just going to be feeling increasingly lousy. And at some point, you're going to go to the doctor and they're going to test your blood sugar. It's a very simple test. And, it'll be really high. And then they'll do the other test to confirm exactly what's causing it.
So then what puts people more at risk for diabetes?
It's a little bit of nature, a little bit of nurture. So we see both in type 1 and type 2 diabetes that there are, trends in families. That means that there's a genetic component to it. But there are other things, particularly with type 2 diabetes, that put you at increased risk. And one of them, of course, is diet. And so if you're overweight, which means you're eating a lot of, high carb diets, you've got a lot of unhealthy fats in your diet, that'll increase, that makes you put on weight, that increases your risk for type 2 diabetes. And similarly, if you don't exercise a lot, so, eating a healthy diet and exercising a lot, and I will tell you, with particular type 2 diabetes, I'm not just saying this because doctors always say that. It really does make a big difference. If you can keep yourself trimmed with a healthy diet and exercise a lot, it really has a big impact on the type 2, on your chances of developing type 2 diabetes, or even just controlling your type 2 diabetes.
Right, because you hear a lot that people are able to control it with a healthy diet, losing weight with exercise. And you have to pay attention to what you're eating, right? So a lot of the healthy greens and vegetables, instead of frying your food in unhealthy fats, you can broil it, you can steam it. There are other ways to prepare your food that won't have all that unhealthy fat in the cooking. Yeah, and so where can people get some help managing their diabetes and maybe getting some more tips and advice like this on a more healthy lifestyle?
So your health department, your local health department will have some type of a diabetes assistance program generally. Here at the Houston Health Department, we have a program called DAWN, and it stands for Diabetes Awareness and Wellness Network. And we help all Houstonians. It doesn't matter whether you're insured or not, or where you come from. If you're a resident of the city of Houston, this is available to you. They give cooking classes, physical activity classes, pre-diabetes and diabetes prevention classes, and a lot of diabetes self-management and chronic disease self-management. And you can get a hold of us at 832-393-4055. Again, it's open to all Houstonians.
All right, we'll link people, give them that phone number on click2houston.com. Dr. David Persh, thank you so much for joining us this morning.
Thank you, Amy.